got another green plaque up here for
That's very
endocrine.
important too.
Yeah.
Let's know.
All right, so to review the female reproductive tract, now this right here is the whole thing, the whole pelvis. So the true pelvis is what's under my hand here. The true pelvis is circumscribed by the pelvic brim, isn't it? The false pelvis is this part. Remember that from A&P1? All right, so we're talking about the contents of the true pelvis here. All right, so what's in here, if I took that part out, it would be this part. Right here, see here? So this is anterior and this is posterior. This is symphysis, urinary bladder, uterus, rectum, like that. All right? So here are your tubes, uterine tubes. Here are your ovaries, here. And this pale blue structure here is the ovarian ligament on each side that connects the ovaries to uterus. The round ligaments, in this case, would be these pale blue ligaments here from top of the uterus going laterally. And so they go out like this and turn and go in the inguinal canals and in blindly. They're for support of the uterus. They have no function otherwise. But they're the female analogs of the male vas deferens. All right? So, what is my fingers on just generally here?
The uterus.
No.
Oh, okay.
Oh,
This covering.
that white
Oh,
thing.
the broad ligament?
Broad
ligament.
Broad ligament. Broad ligament. All right. What's the part of the broad ligament that supports the tube? Mesosalpinx. What's the part of the broad ligament that supports the ovary?
Meso-ovarian.
Mesovarium. All right. Okay. Now, sit this down. And so this is half of this, isn't it? So I'm taking this out to show you what's inside. So this is a sagittal view. All right, so this would be urinary bladder, uterus, rectum. All right. What's this?
Vagina.
Vagina. What's this recess of the vagina called?
It's a fornix.
Fornix.
Yeah.
Fornix. All right.
360 degrees.
Now, in this case, this is anterior fornix and this is posterior fornix, isn't it? But it just depends on how you're looking at it. You know, if we were looking at it from the front, it'd be left lateral and right lateral fornix because it's 360 degrees. All right, so this is uterus then, isn't it? All right. What's this part of the uterus down here called?
The
Cervix. What's this opening right here called?
Orifice? No. It's the
External
external
os.
os.
Okay, here's the cervical canal, isn't it? And what's this opening out of the canal into the uterine cavity? Internal os. All right. Now, on this model here, do you see this pale pink that I'm outlining? And do you see this little darker pink or off red right here, just below it? What part of the uterus am I tracing for you now? What do you call this?
The cavity.
Cavity's here. This surrounds the cavity. Starts with an E.
Endo.
Atrium.
Metrium.
No.
endometrium. Does everybody see that?
Yes.
Anybody not understand that?
Can I look? Yes, that's the endometrium, the darker part,
The pink
the pink.
and the dark next to it
Okay.
is endometrium. So what's the rest of this wall, this thick part here?
Myometrium.
Myometrium.
Mine.
All right.
Endo is in the.
Okay. All right. So that's the female. All right, here's the male. Now, this male right here, do you see this condition down here with the glands? Do you see the foreskin's been removed?
Circumcised.
So this is the circumcised condition. All right? So, what's this skin sac called?
Scrotum.
Scrotum. All right? What is this muscle right here called?
There's,
Vas deferens. No.
Something
Skeletal
cord.
muscle.
Cremaster.
Cremaster.
All right? This is obviously the testis. What's the name of the outer covering of the testis?
Tunica
Tunica albuginea. All right? And what's this structure right here?
Which structure?
The one that's 20 inches long.
20 feet long, girlfriend.
20 feet,
Not
20
20
feet.
inches, 20 feet. Epididymis.
Epididymis. Know how to spell epididymis?
IS, not US.
Now, do you understand that this is not the usual position of the epididymis? They've just turned it so you can see the relationship of testis to epididymis. All right? What is this whole tube called here?
Vas deferens.
2 words.
Something
Vas
cord.
Vas.
Spermatic cord.
Spermatic cord.
Spermatic
Spermatic cord. All right? Tell me all the structures that are in a spermatic cord.
Lymphatic vessels, veins, arteries, nerves.
Vas deferens.
Skull, vein, and artery. Nerve.
All right?
Nerve, I don't know, nerve.
So you got the testicular artery, testicular vein. You got the vas deferens or ductus deferens. You've got autonomic nerves, sympathetic and parasympathetic. You have a spinal nerve, the genitofemoral nerve. You have lymphatic vessels in here. All of that's contained inside this connective tissue sheath called the spermatic cord. All right? What's the name of this little channel here that the cord travels in the groin?
Canal.
Inguinal canal. All right?
Miss Stark is today.
Between her and Hilda, holy cow.
Yeah. She's trying to recover from one she didn't know a while
Yes,
ago.
you're right.
All right? Now, I told you that the internal ring, or I think I did, or should have, that the internal ring of the canal, the internal opening, is next to the femoral vessels. You see these 2 vessels right here? Those are femoral vessels, femoral artery and vein.
Internal ring,
So,
right?
you see the vas deferens here? It's coming out of here in the canal. It's turning into the internal ring, and it's just medial to the femoral vessels, isn't it? Where is it going?
To the
Back here.
Back.
Back here. All right? So, now we're posterior, aren't we? So here is vas deferens. What's this tube?
Seminal.
uh,
Seminal.
that's the ureter.
Oh,
Ureter.
ureter.
All right. What's this organ right here?
Seminal. Gland.
Seminal vesicle.
Vesicle.
Okay. What's the expanded part of the vas deferens called right here?
It starts with an A.
Ampulla.
Ampulla.
So good.
Man.
Girlfriend.
All right. What is this organ right here?
Prostate.
Prostate. Prostate. All right. Now, yeah, this is good enough here. Okay. So, I've taken half of that.
Okay.
I've got a sagittal cut through here.
Okay.
Okay? So, what's this?
Bladder.
Bladder.
All right? What's this?
Prostate.
Prostate.
Prostate. All right? What's this tube right here?
Urethra.
Urethra. What's this little tube that's running through the prostate gland? It's related to these two right here.
Ejaculatory duct.
Ejaculatory duct.
Ejaculatory duct.
You're only seeing part of it here. All right? What's this little gland right here?
Oh, well, I don't know. That's the mucus gland. Something.
Yeah.
The mucus gland.
Bulbourethral gland.
Urethra gland.
All right?
Is that the mucus?
It's a mucus secreting gland. And it's bilateral. You're only seeing one here. The other one's over here.
Just two.
All right? Another name for this one is Cowper's gland.
Bulbourethra.
Cowper's is spelled capital C-O-W-P-E-R apostrophe S. So you can call it either one you want to. So where would you look for the bulbourethral gland? Well, here's the pelvic floor. So it's right adjacent to the pelvic floor,
Okay.
just inferior to it, right there. All right. Okay. Now, let's look at those pigs.
Do we need to wear gloves?
No, I'm going to wear the glove. And I'm going to point out some things on these pigs for you.
Get in my way.
You here to cause trouble?
She studied it hard.
I'm gonna hit you guys.
Did you tell your compatriot about the Reedy testis?
Yes, I did, sir.
Oh, yeah.
Unlike me who just left during class.
Yeah, I noticed. BLB.
X.
XBLB.
I'm gonna have to look at this.
Okay. So let's do endocrine review first. Major endocrine organs.
Thyroid.
Thyroid gland. Okay, what's left of it? Thymus.
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 Sorry.
Parathyroid you can't see.
Next to, they're
Yeah.
behind it, right?
Yeah.
Okay.
All right. Pancreas
Pancreas, right there, the green thing.
is right here.
Right there.
Now remember, the pancreas is posterior to the stomach, so here's the stomach, so it's been lifted up, see? So this is pancreas right here. All right? This is small intestine and large intestine here. All right? We've got to move them over. What's this?
Kidney.
Kidney. All right? Look at the superior pole of the kidney. Do you see this gland right here?
Adrenal.
Adrenal gland.
Adrenal gland. And of course they're bilateral, aren't they?
Yes, sir.
So if you come over here, you see the other one right here. This kidney has been kind of boogered up, somebody cut into it. But this is the other adrenal gland right here.
Okay.
So look at the superior pole of the kidney to find them. All right?
Yeah.
So this is a male. So let's start down here. Now we've had to remove some stuff here, but if he were all together, it would be like this here, you see? All right, now, the scrotum is down here, and it's been sort of split a little bit, but this skin sac right here, all this skin sac is scrotum, right in here. Out of that came this. This is testis. See that? This is testis. And this little organ that's plastered right on the very back side of it here is epididymis. See that? See, it's separate from testis, but it's immediately contiguous to it. You see that?
Mm-hmm.
All right, that's epididymis. All right, what would this be right here then?
That's different?
Vas deferens?
Well, the vas deferens would be
Spermatic cord.
in here,
Spermatic cord.
but this would be the cord, wouldn't it?
Okay.
So the vas deferens is just one component of it,
Right.
right?
Okay.
In fact, that's
Right.
probably it right there. You
Okay.
see that?
Good. You see it? Yes. You
All
can
right,
see.
but let's follow this up. Now, this is urinary bladder, isn't it?
Mm-hmm.
All right. So we follow this up, and you see this teeny little tube right here that my probe is under?
Mm-hmm.
That's-
Can I get close?
That's vas deferens right there.
I can't get focus.
Well, maybe you can now. You see this tube here?
Mm-hmm.
That's vas deferens. It's got a tag on it. It tells you it's vas deferens.
Mm-hmm.
Now look right here, across the way.
Mm-hmm.
Isn't this the other one right here?
Mm.
This is the left one. This is the right one.
Okay. I
See that?
Mm-hmm.
See the right vas deferens here?
Mm-hmm.
So they're headed down behind the bladder, aren't they?
Mm-hmm.
All right. Now, if this is bladder, what's the tube to the outside called? Urethra. So this is urethra right here. You see this? See this?
Oh, yeah.
This is urethra coming away from the bladder. Now, in a male, that urethra is going to curve around and head up here, and here's the external urethral orifice right here. This is a male, see?
Oh. Okay.
You follow me?
Yes.
Now, this urethra right here, this is going to curve around, and you see this structure right here?
Mm-hmm.
It's got the tag on it,
Mm-hmm.
and see this?
Mm-hmm.
This is the penis.
Oh. On
So-
the pig.
So the urethra is in there, isn't it? All right. And so if you follow this on up, here's the external urethral orifice right here.
Mm.
And that's where this pin was that just came out.
I didn't even see what a penis is.
See? Like that. All right. Let's move over here. The female. Now, here's the cord. Here's the bladder, correct? All right. Let's start right here. What's this organ right here?
Mm.
Bladder's here.
Vagina.
What's behind the bladder? Uterus.
Oh.
See, the pin is in the uterus here.
That little thing?
Yeah.
Here's the uterus right here. See this?
Wow.
That's uterus.
Yeah, that
Well, this
was
is fetal
not-
pig, remember?
Fetal, yeah, fetal. Okay.
All right. Okay, that's the uterus right there. If that's the uterus, then what are these?
Fallopian tubes.
Oh, yeah.
Not so fast. You would normally think these would be the uterine tubes, wouldn't you?
Yes.
But this is a modification of the uterus. These are uterine horns. You see here?
Wow.
These are extensions of the uterus. This is what allows pigs to have litters
Ah.
because there's more room.
That was pretty awesome.
There's more room in there, right? So if these are not the tubes, we got to look elsewhere for the tubes, right? Well, let's look back here and see if we can find the ovaries first. All right, here's a pin that's in an ovary. So see this little thing right here? That's an ovary.
Mm-hmm.
Here's the other ovary right here. You see this? See this
Yeah.
little bump?
Yeah.
That's an ovary. All right. Now you got to look close. But you see that tiny tube next to the ovary right there? That's fallopian tube.
Oh. So they are horns?
Yeah.
Fallopian horn?
No, the
Or
fallopian tube
Uterus.
is going to be in proximity to the uterine horns, you see? Okay? In fact, here you go. Here's the tube coming this, well, here's the tube right here. See this little thing? That's part of the tube. But you got to remember that in the pig there are extensions of the uterus called uterine horns.
Okay.
All right? Now, so if this is bladder, what's this tube right here? Urethra. All right? If that's the urethra, what's this tube behind it?
Rectum.
Nope. Vagina. If that's vagina, then what's this tube behind it?
Rectum.
Rectum. So it's urethra, vagina, rectum, from ventral to dorsal. All right? Now, there's a difference here in the pig relative to the human. In the human, the external urethral orifice and vaginal orifice are separate and come all the way to the outside, as you saw in the slide, right? In the pig, the urethra doesn't come all the way to the outside. It opens into a little space right down in here called the urogenital sinus. A sinus is a space, isn't it? All right. The urethra opens into that space. The vaginal orifice shares that space.
Ah.
All right. So there's one opening to the outside here. Okay. So urine comes through the urethra and into the urogenital sinus and out. In intercourse, the male penis goes in that opening into the urogenital sinus and deposits the semen next to the, or into the vaginal orifice.
Okay.
Okay, so that's a difference in the pig from the human right in here.
Okay.
So the urogenital sinus, it's not labeled here as urogenital sinus. It's labeled urinary meatus, which means a meatus is an opening. So the urethra opens into a space here called the urogenital sinus. All right? And so that opening to the outside then is right there. See my probe is in it here? And if you look in, see my probe? See where my probe is wiggling in there? It's in the urogenital sinus. You see that? See where the urethra and the vagina are coming down into that space? That's the urogenital sinus. This little nipple-like projection right here is the genital papilla. It's only present in a female. So you can take a quick look at the back end of a pig and tell whether it's a male or female. However, if it's a male, all you got to do is look over here and find the external urethral orifice, and you know it's a male. All right? So you can move, these structures around if you want to. Try not to dislodge the